Okay, step 1. Apply occlusive dressing. A. Expose the injuries. B. Apply an occlusive dressing to the entry wound. Upon full expiration, cover the wound with a large occlusive material dressing, covering the first wound encountered. Ensure the material extends 2 inches beyond the edge of the wound. Tape all 4 sides of the dressing, if a non-adhesive dressing. Log roll the casualty on unaffected side and examine the back for an exit wound. Apply an occlusive dressing to the exit wound using the same standards as step B. Verify the presence of tension pneumothorax by checking for at least 3 of the indications below. Verbalize as needed. Question the casualty about difficulty in breathing, pain on the affected side, or coughing up blood, and observe for signs of progressive respiratory distress.
Checking for breathing.
Greater will state casualty is gasping for air and has pain on the wound side. Observe the casualty's bare chest for respiratory rate depth and abdomen for progressive distension.
Checking for rate of breathing.
Greater will state casualty has poor respiratory rate and depth and the abdomen is mildly distended. Look for mediastinal shift manifested as a tracheal deviation and or jugular distension.
Checking the trachea.
Greater will state casualty does not have tracheal deviation but has mild jugular distension. Look at and feel the patient's chest for signs of air in the chest wall, subcutaneous emphysema.
Checking for air in the chest wall.
Greater will state you feel a crackling sensation on the casualty's chest. Check for unilateral distension and chest expansion.
Looking for even rise and fall.
Greater will state the hand on the unaffected side is higher than the other. Look for bluish skin.
Looking for bluish skin.
Greater will state you observe mild cyanosis. Look for signs and symptoms of shock.
Looking for signs and symptoms of shock.
Greater will state you observe 2 signs of shock.
Alright.
Locate the insertion site. Locate the second intercostal space between the second and third ribs at the midclavicular line, approximately in line with the nipple, on the affected side of the patient's chest. Thoroughly cleanse a 3 to 4 inch area around the insertion site. Begin in the center and work outward using a circular motion. Apply a commercial needle decompression kit according to manufacturer's instructions, or improvise by inserting a large bore needle with attached catheter. Place the needle tip bevel up on the insertion site. Lower the proximal end of the needle to permit the tip to enter the skin just above the third rib margin. Firmly insert the needle into the skin over the third rib until the pleura has been penetrated, as evidenced by feeling a pop as the needle enters the pleural space. Remove the needle and discard per unit SOP. Decompress the affected side by aspirating as much air as is necessary to relieve the patient's acute symptoms. Apply a commercial one-way flutter valve according to instructions or improvise using the method below. Cut a finger casing from a sterile glove. Cut off the fingertip. Tie or tape the finger casing to the needle hub. Check the operation of the improvised flutter valve. Ensure that air passes through the needle valve assembly and improvised flutter valve on expiration.
Flutter valve is operational.
Ensure that the flutter valve collapses upon itself upon inspiration. Secure the catheter to the chest. Measure pulse and O2 sat. Wipe the index, middle, or ring finger tip with alcohol to ensure it is clean and dry. Apply the sensor. Document the readings on the TCC card. Record all treatments on the TCCC card. On the front of the card, evacuation. Mark an X on the casualty's evacuation priority, precedence, urgent, priority, or routine.
Urgent.
Dates. Write date of injury in 2-digit day, 3-letter month, 2-digit year format.
23 November NOV 20.
Time. Write 24-hour time of injury indicating whether local or Zulu time.
10:52 Lima.
Mechanism of injury. Mark an X on the mechanism or cause of injury.
Gunshot wound.
Injury. Mark an X at the site of the injury on the body picture.
Right side of the chest.
Time. Write time of vitals taken.
10:52 Lima.
Pulse. Write casualty's pulse rate.
145.
O2 sat. Write casualty's O2 sat.
90.
AVPU. Write casualty's level of consciousness.
Alert.
On the back of the card. Evacuation. Mark an X on the casualty's evacuation priority or precedence.
Urgent.
Mark an X for all circulation hemorrhage control interventions.
Needle D. Chest seal.
Mark an X for all breathing interventions. Needle decompression, chest seal. First responder name. Print the first responder's name, last and first.
Doe John.
First responder last four. Write last four numbers of first responder social security number.
1234.